Looks like we're in business.
Thank you.
Thank you. Good morning. I'm State Representative Jonathan Steinberg from the 100th. Once more, I'm State Representative Jonathan Steinberg from the 136th District, the town of Westport, and I am co-chair of the Public Health Committee. We are here today, today being the last day for public hearings of this committee, but we start with a special forum this morning. For the next hour and a half, we will be talking with the members of the Lighting Task Force that has labored for a good period of time, particularly during the pandemic, to come up with a number of recommendations which have informed a piece of legislation that is before this committee. I will simply state, because others will state it more eloquently, that the situation in lighting was simply not sustainable. The problems were widespread, systemic in many ways. But I am hopeful, based upon the recommendations brought forward by this task force, that we can chart a path to being able to keep all the residents of this particular facility safe and provide a measure of quality of life in very difficult circumstances, even as we recognize some of the changes that need to happen will not happen immediately and will require potentially significant infusions of capital in order to provide a facility that is modern, can meet the needs of people today. We have a long ways to go, but this is a critical first step along that path. And without further ado, I will hand off to my esteemed co-chair, Senator Anwar, for any opening comments.
Thank you so much, Representative Steinberg. Good morning, everyone. I am Senator Saud Anwar. I represent the 3rd Senate District, including the towns of East Hartford, South Windsor, Ellington, and East Windsor. Hospitals are places generally felt to be a place of protection, a place of well-being, a place of healing. And if things go wrong, it can just be the opposite. It can lead to harm, it can lead to pain, it can lead to worsening, and it can lead to new diseases, if you will. And I've had the sad opportunity to meet with individuals who have been deeply impacted by their experiences, and they have been scarred for life. And the trajectory of their life has changed completely. When things happen the way they had, it becomes a responsibility for the state and everyone who is concerned to identify what can be done to address this. And I wanted to thank the committee that has worked very hard to give us some recommendations. And we look forward to hearing from you directly as well, and then make sure that we are able to do the best. And we cannot go back in time and fix things, but we at least can fix things going forward. And I look forward to a frank conversation around today. Thank you so much, Mr. Chair.
Thank you, Mr. Chair. Next, I will welcome Senator Wong. Good morning.
Good morning, Mr. Chair, and I want to thank the members of this task force for their hard work and their efforts. As you said earlier, what is done. We hope to learn from these lessons, and indeed, it is unsustainable what has occurred, and our hope is to learn more from the good work of the members of this esteemed task force to move forward and create solutions and create a sustainable model moving forward. So I'm very eager to hear this, but also I want to share for the greater audience that there are other committees going on, and people may be popping in and out that will read the committee's work diligently. But thank you, Mr. Chair, for this opportunity, and I want to thank again the task force's good efforts.
Thank you, Senator. And I should be clear, this is an informational forum. The actual public hearing we're having today on the Lighting Task Force recommendations and several other bills does not begin until 11 a.m. So let's be clear on that. Good morning, Representative Pettit. Have I caught you at a tough moment?
No. Good morning, Mr. Chair. I did the previous remarks and really thank the task force. This was a very difficult job, and they met for a long time, considering very thorny questions, and have put forth a great effort. And I really thank them for their public service. Thank you, sir.
Thank you, Representative. I noticed that Senator Summers, one of our ranking members, is not present, but I want to right out of the gate, laud her efforts going back several years. She focused in on the problems at Whiting a number of years ago and did a lot of basic work in having conversations with people. And I believe that her commitment is it has led to the direct result of this task force and the actions that we will likely take if this legislation is passed. But without further ado, I'd like to hand it off to Linda Schwartz, who will handle the introductions of members of her task force. And it's really up to you to how you want to handle this hour and a half. We view this as a conversation, somewhat different than we would in a public hearing. But obviously, I advise all my colleagues to try to be as direct as possible, limit the extended commentary so that everybody has a chance to ask questions, and we can conclude this forum with a pretty good understanding of what has been recommended and how it impacts the legislation we are considering. Linda, thank you for being here.
I'm not here. I'm really in Washington, but
Close enough.
through the magic of Zoom. Good morning, Senator Representative Steinberg. And I want to be sure, can the members of the committee, can you actually speak, or are you? Is your mic live?
Everybody is a panelist here.
All right, so actually I misunderstood, but I guess we could start with Mr. Lawler to introduce yourself and then go through the good morning, or is it good evening in Italy?
It's Buonasera. It's 3:15 here in the afternoon, but I'm teaching at our university's campus in Prato, Italy. That's why I'm saying good evening. But in any event, first of all, let me just thank the members of the committee. I know, and I'm glad Representative Steinberg, you just thanked Senator Summers, because I think that much of the focus on the issues at Whiting Forensic and Connecticut Valley Hospital go back to her initial efforts very early on in this, and as a result, I think we've over the last almost 3 years now, our task force has been meeting interrupted as you were by COVID in many instances. We've really had a variety of perspectives, both as members of the committee, members of the task force rather, and members of the public and affected individuals, advocates, consumers, people who are both prosecutors, public defenders, who are involved in different ways in the system, have more or less told us what they thought we needed to know. And the one thing I've learned, and I think I speak for all members of the task force, is these issues are really multi-dimensional. There's many issues in play here. There's the obvious issues that led to the creation of the task force in the first place. You know, this outrageous criminal behavior by some of the people that used to work at Whiting Forensic. They were successfully prosecuted in the criminal courts for that. There was a long track record of issues related to the care being provided to the patients. We actually met with patients firsthand in person at Whiting Forensic on several occasions, some on Zoom, some in person, and got a lot of insights from them. Met with the medical staff, some of the professional staff. We met with family members. We met with many community advocates. And so I think we got a general idea of what people's concerns are and what their suggestions are for improving the healthcare that's delivered at the hospital, and also safety in the community as it relates to people who have been committed to this facility for, in many cases, committing some pretty serious crimes. So I know we're going to have an opportunity to go through our recommendations in a few minutes. I'm here because, I used to be like you folks, but I'm here now as a member of the academic community, which has an interest in these things as a professor at the University of New Haven.
Dr. Vogt. Good morning.
Good morning. Good morning, Representative Steinberg. It's good to see you, albeit remotely. So I'm on this committee because as the task force was put together, there was a request for a present or former president of a hospital, at least 200 bed size. So since we met, I've been both a present and former Now I'm a former president of a hospital. I was president of St. Francis Hospital when we started, and now I'm the former president of St. Francis Hospital. We've met for a couple of years now, and I have to say, I want to just publicly acknowledge my colleagues on this task force. I came into this, with a very limited knowledge, I have to say. I know how to run a hospital, but not a forensic hospital. And I learned a tremendous amount from my colleagues. We got a lot of testimony. We did a lot of touring, and I learned a tremendous amount. So I think I learned more than I contributed to this process, but we are here to help clarify any questions that the legislature would have. But thank you for allowing us the time to speak to you today.
Nancy, could you
Good
introduce
morning.
yourself?
Good morning. My name is Nancy Allisberg. I am the former managing attorney at the former Office of Protection and Advocacy for Persons with Disabilities. And until my retirement, I was the legal director at Disability Rights Connecticut. I had the honor of being placed on the task force to represent the interests and the voices of the patients as an advocate for those who reside at Whiting. And it truly is an honor. I've had the good fortune, both through my work on the task force and previously as an attorney at Disability Rights Connecticut. And now I'm also a member of the PAMI Advisory Committee at Disability Rights Connecticut, of getting to know a number of the individuals who reside at Whiting. And I'm very proud to say that the work on the task force was unique in that, for the most part, what we eventually came away with was total agreement, with one exception, on our recommendations. And that, I think, says a lot, because we're all coming at this from very, very different places. So I think it's important to keep that in mind when you look at our recommendations and think about how to enact legislation that's going to enforce those recommendations. So thank you very much.
Good morning, Paul. Could you introduce yourself?
Yeah, hi. My name is Paul Acker. I'm the program manager of advocacy and education at Advocacy Unlimited. I was appointed by Senator Looney as a person with lived experience in the mental health and addiction services of the state. I think that, I concur with what my colleagues have said about our work and the product of that. And I feel proud to, stand with the task force in support of our recommendations.
Good morning, Dr. Hauser. Can you introduce yourself?
Good morning. I'm Dr. Lori Hauser. I'm a supervising forensic psychologist in charge of the competency restoration service at Whiting Forensic Hospital. I too was appointed by Senator Looney to represent the forensic psychologist perspective on the task force. And I agree. I think that it was a very thoughtful assembling of different perspectives, and it made our discussions very educational and lively. And I think it made sure we covered things from all the different perspectives. So I appreciate the opportunity to be a part of this. Thanks.
Thank you. And I will just introduce myself. I am Linda Schwartz. I actually have experience as a public health nurse. I was working with a grant in the city of Norwich many moons ago, but it was my patient population were all the psychiatric patients that had been discharged from Norwich State, and we were helping them into the community. From there on, I became the Connecticut's Commissioner of Veterans Affairs for 11 years, and then actually was working as the Assistant Secretary of Veterans Affairs in Washington for several years. So I have a few things. First of all, thank you very much for this opportunity. I especially want to thank you for addressing this issue and for giving me a chance. And many of my cohorts here with the task force of allowing us the opportunity to helpfully turn this around and to add our knowledge and experience to making a difference in how the patients will be treated at Whiting and CVH. This group was constituted in the 2019, the spring of 2019. Because of the COVID, we started out meeting monthly, but because of the COVID, we did actually were able, because of Zoom, to actually have meetings twice a month, which I think speaks to the dedication of everyone in this group to get the work done and do the best we possibly can. So, we had over 42 meetings in 33 months. We took tours, as Mike mentioned, of Whiting and CVH and Dutcher. We also commissioned a study about the aptitude and attitudes of the staff, because the staff is a very important part of what's going on. And that was done by Sarah Wakai from UConn Department of Medicine. And that is actually, part of that is in our report. I'm going to refer to our report because I hope everybody has a copy of it. And it was not just one person writing, it was us all kicking in, and you can see our fingerprints collectively all over it. So it's not just one person's attitude. We had 2 patient forums and 2 virtual public forums. And we also had attended a meeting of a group within the hospitals, the patient group. We want to thank Beverly Henry and her staff and all of who helped with their wisdom and wit. And we could not have completed this task without her. So let me start out, and I'm not sure how you want to do this because I was expecting something different, but I just want to—
What were you expecting, Linda? We're glad
actually,
to accommodate you.
Actually, I wrote a whole report for you.
Well, the assumption is that we've all had an opportunity, at the very least, to look at the recommendations that are part of the legislation. So what I would suggest is this: you've given us a little bit of your process. If you could help us understand what you felt your charge was, and then dive fairly straightforwardly into the recommendations, I think that would be the most useful, and perhaps make sure we leave sufficient time for all we legislators to ask questions.
Okay.
So the degree to which that conforms with what your expectations were, if you need to vary a little bit from that in order to get it all in, we are here for you.
Okay, great. The task force identified 3 overarching themes that rose from our work. And they were the conditions and culture, the operations of the hospital, particularly the physical plant at Whiting, and with the respect of patients and accountability within the system. We organized our report along those lines, and I'm just going to say that the task force has noted that several of the suggestions we made in the final report have been incorporated into Raise Bill 450, and we are very heartened that members have addressed the concept of a new beginning for this patient population and for Connecticut. We have an exquisite opportunity here to use the technology and the best practices and use data analysis to help us create a state-of-the-art system that cares for these patients and reflect the compassion and determination and the ingenuity that has been the hallmark of Connecticut and its citizens. You have obviously seen the difficulties with the physical plant. I would wonder how many people have actually ever been to Whiting or good morning, Senator Summers.
Good morning, Linda. Thank you so much for being here.
If you go there, you don't. It's like walking back to the 1960s. and the state of the, and I will reveal that I was a nurse in the 1960s, so I can verify that. But we have to capture the creativity of our state, and also look at the state of the art of what is being done for psychiatric patients in this day and age. After our visit to there, and members can speak up, it was a unanimous agreement. I asked, is this a hospital? Is this a hotel? Or is this a storage space? But we believe that the maximum security, the reason for a lot of the despondency on the part of patients and the low morale of staff have a lot to do with the surroundings in which they work. And we, I'm just going to read off what our recommendations were, and then if the committee wants to chime in, it has to be reorganized with the stated goal of both safety and recovery and a pathway towards returning to the community integration. We started by saying, don't build anything, let's do an assessment of the needs of the state. Dr. Rodas, that was your main point about this is not a hospital. This is, there's no signs of a lot of activity or even hope here. But by doing an assessment of what is going on in our state, using the data that we have, using the information that is available to look at the future service needs of the beds of a new facility, and which evolves from the state of the art. One of the things that I think we all felt was that the real place for the people is not within the walls of those hospitals. Yes, that's a place for them to heal, but they need to be back in the community. And we need to refocus Connecticut once had a very vibrant community program, but we need to look at that as an extension of the whole treatment of what is going on in Whiting and community CVH. We also talked about a continuum of moving through from being admitted and moving through with the idea in mind that you're not going to stay there for the rest of your life. And that there is a way in which people can progress and know they're progressing through the system. Along with that continuum, the task force also discussed the need to strengthen community-based services and supports. The community services is something that will be both beneficial for the patient, but also it's cost-effective to the state. Although we talk about the physical situation at CVH and Whiting, there was, the whole task force agreed that when determining where monies are to be allocated, preference should be given to the community services over institutional enhancements. Does anybody have any other thing they want to say?
If I could chime in briefly, I just want to emphasize what Linda just said about the facility itself. Some of you have been there. I've been in every prison in Connecticut multiple times, and I don't think this would even be appropriate to have a prison like this, just the design of the building itself. And as a result, a lot of things flow from that. The morale among the staff, for example, the ability to provide services. And there's some real security concerns in that facility just because of the way the movement is restricted to a circular or almost like diamond-shaped corridor that runs throughout the whole building. I mean, it's just like a bad design on many different levels. So I think first and foremost in my mind, the time is now to start planning for a different facility to provide this service. Another very important thing that emerged for me, at least throughout the course, was the fact that there's a very real perception of racial disparities in the way the staffing is handled. And there's a perception among staff members of color that they're not treated fairly, and this is explored in some detail in both the survey that we've attached to our final report and in the findings that we've made. And I would encourage you not to overlook that very real fact. Oversight. Two things. Number one, there is an advisory committee that's always existed for Connecticut Valley Hospital for Whiting, and we met with the members of this statutorily created group. And among other things, they told us that if they asked for information, they were told by the department they needed to file a Freedom of Information request to get it, which, I mean, they are state officials because they were appointed to this oversight board, and yet they're meeting roadblocks in their ability to obtain information. And so a key recommendation we've made is to give them more authority to find out what's going on and match that up with some staffing. And, you know, whether you call it an inspector general or something else, someone whose job it is to sort of do the kind of work that our task force has been doing basically on a volunteer basis, except for Beverly, who's been the only real staff person to sort of entertain this stuff. And the final thing I want to mention, which is easy to lose sight of, but that is the sort of process by which people come into the system. It turns out, you know, criminal courts every day are getting people who come through the front door who clearly have signs of serious mental illness. And frequently, I mean, I used to be a prosecutor. I was also a defense attorney in our state's courts. I mean, just by default for lawyers and judges who really aren't trained in this kind of thing, to ask for what they call a competency evaluation in court for someone who may be facing very minor charges, but clearly has a serious mental health issue. Those people will be sent to the Department of Correction, to one of our local jails. They're really not equipped to deal with this stuff either. And along the road, some of these people end up at Whiting Forensic Hospital, even though their offenses, the conduct they were involved with is relatively minor. And we heard this from the staff that they're seeing more and more competency cases coming through the front door. And, you know, once you're in the system, it's hard to get out. And I think finding a way to look at the very front end, maybe keep these sort of low-level people out of the criminal justice courts and stuff in the first place. And again, this gets you back to having more community services available. And I understand all this is expensive and complicated, but it's a problem that seems like it will only get worse if it's not dealt with today. And in the back of your mind, I hope you understand the cost of doing nothing is going to begin to skyrocket. There's some pending cases against the state by patients there. There's other injunctive action that's been filed against the state. This can all get really, really expensive if these issues are not attended to. And, you know, I don't envy the job that all of you have as policymakers here, but there's some real problems that need to be addressed.
I see a number of hands raised. Linda, I think it'd be best if we heard from members of your task force, but I want to assure Senator Summers that she has the preeminent position to ask questions once we get to legislators.
Would you like me to recognize them, or are you sharing the session?
You probably know them better than I do, so why don't you recognize?
All right. Well, I'll start with Senator Summers because I agree with you, as she has the.
Well, actually, if you wouldn't mind, I'd like to reserve questions from the legislature until your members had a chance to make their initial comments, which may actually anticipate some of the questions we would ask.
All right. Well, then I'll recognize Dr. Rodas.
Well, all right, Nancy, you had your hand up first, but I'll just jump in. I just want to, as I'm looking at all of you here, I recognize that some of you actually were born after some of the issues at Whiting have been occurring. And I think it's an important point that we're talking of decades of issues. So I just wanted to make that point clear, particularly for the newer and younger folks, to realize that this has been a long-standing issue. And the point I'm making is why we're calling for a layer of oversight that just has not existed, functional, effective oversight. Because when you hear of something that's been going on for decades, you have to question, where's the accountability? And I think that's just one point I would like to make. The second point, just so we're clear of what Mike was just talking about, if from a hospital administrator point of view, we're very focused on flow of patients through the hospital. And for those of you who have had loved ones in the hospital, I think you could relate to, there's a lot of opportunities for delays along the way. And I think in this forensic hospital environment, there's a lot of blockages and roadblocks along the way. And I think Mike started with the first one, really, which is that the system is front loaded with folks that probably don't need to be there, or at least should be handled much more effectively with greater alacrity, so it doesn't gum up the works from the beginning. And that's the competency restoration. Then the flow of patients through the system is in some cases impeded really by the PSRB, which really, as you've learned, probably is only few states have such a thing, but they really don't need to be in between the clinicians who are saying, okay, this patient is ready to move to the next level, and they kind of imposed in that step, and they need to be. I think they shouldn't be part of that process, and I think that's in our report. Then finally, on the way out, forget the middle part. There's a lot of stuff in the middle, but I'll let my colleagues talk about it. But just actually the development of the services to the patients so that they can have restoration. But then finally, when they're ready to transition out, the really lack of, I think, investment and commitment to the community services so that people have a place to go. So there's nothing more, in my mind, more shameful than folks have been here for years now, ready to make the transition out into the public domain, and they can't get out. There's nowhere to go. I'll finally, regarding the facility, I just, as a means of background, I've been in this state for 35 years, and I've worked at the University of Connecticut, where we had indeed a prison hospital within the hospital, as you all know. I worked at Stanford Hospital. We had an inpatient psychiatric unit. And of course, at St. Francis, we had several inpatient psychiatric units at our Mount Sinai campus, and I had responsibility over these areas. Whiting is neither a hospital nor a prison, and I think Mike made that point. I just want to highlight that. I couldn't tell you. I never had a feeling going through it. This is a hospital, and frankly, I wasn't really quite. It's probably leaned more in a prison than a hospital. But I think there was nothing about the environment that was nurturing and healing the way one thinks of a hospital. And so I'll just stop at that point. But I want to once again thank you all for the opportunity to speak to you today. I think Linda, I think Nancy was next.
Yeah, I saw Nancy. Yes.
Thank you very much. I want to second most of what John said. I agree with everything he said. We've talked a lot, and Linda talked a lot about the new facility, and I agree with it. The facility is clearly something that stands in the way of recovery. However, I don't want you guys to get lost in the facility, because what we don't want to have happen is to build a beautiful spanking new building and then transfer everything that's been at Whiting to the new facility. So it's not going to be any better if we just have a pretty building, but the same kind of services that have been provided at the current facility. I want to talk a little bit more about the PSRB. As you know, one of our recommendations was that the PSRB be abolished. And I know in Bill 450, you have recommended a task force to study whether or not the PSRB should be abolished. I spoke in my personal testimony when we get to the hearing about why I think that's not a good idea. The recommendation's already been made. You asked us to look at the PSRB, and we did exactly that. And so our recommendation is clear. I think that what might remain necessary would be a work group to look at what replaces the PSRB. But the problem with the PSRB is that it turns what is called a hospital into a prison because it's punitive. If you look at the length of time folks are asked or are required to stay at Whiting, it has nothing to do with their recovery or how they're doing. It's just what the PSRB thinks is an appropriate amount of time, which is clearly not the way psychiatric care should be provided, is not the way it's provided in non-forensic hospitals, and does nothing to help the recovery of the individuals. You made us start by looking at that the considerations have to be not just for whether somebody stays in the hospital, are not just concerns about the protection of society, but the safety and well-being of the acquittee. But I would submit that we also need to look at recovery. Safety and well-being is a nice general term, but it doesn't get to the heart of what psychiatric care should be about, which is recovery. And so I'd like you to think about that and consider that as well. But again, unless you look at all of the kinds of recommendations that we've made, changing the facility is not enough. It's a start, but it's not enough. Thank you.
Paul?
Yeah, thank you. Yeah, I definitely concur that you can't put spoiled milk in a new refrigerator and expect it to become fresh. The thing that's really concerning is, to me, at least at this juncture, is we did a survey of the employees 4 years after the Shahadi incident placed this institution under the microscope, basically. And out of that, 24% of the total employees reported seeing staff-to-staff bullying within the last 6 months at the time of the survey. To me, having 24% of any work environment be that hostile, there's a lot going on there. I agree with Representative Steinberg that there are a lot of systemic issues here. You can look at the report coming out of Fairfield Hills in the 1970s and see a lot of the same stuff going on today. I think that, it's a very complex issue. There's a lot that goes on with institutional care that systemically leads itself open to abuse and neglect, and things that we really need to challenge ourselves to take a look at it. So that we can do better, because right now, as it sits, it's not a matter of if abuse will happen again, it's when, in my mind, that there hasn't been enough change going on that helps me feel that we've turned a corner.
Are you done, Paul? Lori? Dr. Hauser?
Hi, thanks. I wanted to echo a couple of things that Mike had said as well, particularly about the early part of the system, the competency, which is what I'm most familiar with. There is sort of a national movement across the entire country to try to revamp competency restoration as a whole, particularly inpatient, and a push toward using more jail diversion and outpatient restoration services. So Connecticut is a part of that, and actually in some ways, does a lot better job than other states in doing that already. But one of the things that I want to highlight that I keep emphasizing, and then that doesn't really cost any money whatsoever, is to have all these agencies that are there. So as Mike said, there are so many factors that go into this. There's so many issues and agencies and touch points that are sort of all interconnecting. Having regular discussions among those agencies to figure out who's coming into the pipeline, how we can reroute them somewhere else, how one policy change in this part of the system affects that part of the system. Having these regular discussions is a very easy thing that can be done by having, all folks from, representatives from these agencies meet on a regular basis to brainstorm and come up with ideas and solutions to these problems, and to continue to evaluate how things we do today affects things down the road. So having individuals speak to each other and sharing data and using data-driven analyses to make these decisions, I think is crucial moving forward. So I just wanted to emphasize that.
I just want to highlight some of the things that were said. First of all, about the PSRB. We have made a recommendation that may indicate what prompted our response about this. The task force agreed and noted with concern that the present practice of the review of the equities commitment once every 2 years is far too long a period of time, and that we are recommending that the PSRB statute be amended such as that a review is conducted every 6 months unless the patient specifically waives the right to such review. Every 2 years? Really, they have to look at the workings of that. And another thing that came up is when we were talking about accountability, we were talking about the advisory committee, the Whiting Advisory Committee, talking to us about the fact, I am familiar, and you are too, probably most of you, about how advisory committees are appointed, especially if they're appointed by the office of the governor, which is what the Whiting Advisory Board was. But there you have these people, there's no way for them to communicate. There is a way, but they didn't use it, didn't know it. How can the advisory committee let you, the legislators, know what's really going on and what's concerned if they have to go and get a freedom of information dynamic going for them to find out what's actually happening in their hospital, where they're supposed to be the advisory board? Many perspective is the fact that the advisory boards are your fail-safe. They're the ones that are supposed to be keeping their eye on things and have a real conversation, a real way to affect change. But that didn't happen because they didn't even know what was going on. So there is a process by which an advisory committee can, and you should consider this in drafting the legislation as well. When an advisory committee, or we have also suggested the Office of Inspector General, when they find something wrong, and just as was mentioned a little while ago, things have been happening over and over and over again in Connecticut, and it's not new. What is missing is accountability. So if you have an Inspector General that will be able to look into suggestions or complaints, find out what's going on, give the agency a chance to self-correct, but at the same time let the Committee of Jurisdiction of the General Assembly know what's going on. That's the way it works in many places, and I suggest that process as well.
Thank you, Linda. We really appreciate this input, particularly the nuances that I think that are not necessarily apparent from the report proper. Hearing your personal perspectives and some of the specific examples of where things have gone awry are particularly useful to us. We're going to now shift to having an interaction between legislators and the committee members with questions. Before I do that, I just want to say a few things for the benefit of the watching audience. First of all, in terms of expectations, the recommendations that inform the legislation come out of the task force, but you will note that there are certain aspects and recommendations that are not present in the legislation currently, or as Linda has alluded to, have changed in some manner. That reflects to some degree legal drafting, but more importantly, what we think we can accomplish. And I think expectations are very important. You've heard much talk about the critical recommendation of replacing the facility, which is simply not going to work going forward. But it is certainly not totally within the purview of this committee to assure the capital necessary to actually pay for such a facility. This is something which will be a negotiation likely with the governor, if and when we can make it happen in the near term. Secondly, many of the things we're talking about here today have as much to do with the law in the state of Connecticut as they do with the actual functioning of the Whiting facility. And that is also somewhat beyond the purview of this committee and will likely lead to the referral of this legislation, should it pass out of the Public Health Committee, to the Judiciary Committee for further consideration. And I want people just to be aware of that. Secondly, I want to acknowledge the efforts that you've acknowledged of our own Administrator, Beverly Henry, and over time, a number of other staff members. Yes, you would not be here today talking to us if it weren't for Bev, and we all appreciate Bev and all she does, though I will not speak for her. I don't think she's necessarily interested in being poached for your future needs. You'll have to take that up with her personally. Lastly, before I hand off to Senator Summers, once again, since she wasn't present previously, want to acknowledge the fact that we would also not be here if it wasn't for Senator Summers, who years ago spotted this problem, which may have existed for decades, but hadn't penetrated the consciousness of legislators, and doggedly, insistently kept us on a path to getting to the bottom of these things and creating this task force. I cannot express enough how much we are indebted to her and her efforts that we are finally getting a focus on something that has needed to be changed for so long. And with that, I'll hand off to Senator Summers.
Well, thank you for all those kind words. I would like to personally thank all the members of the task force, because I know it was a very hard job. 2 years of many meetings, and I know a lot of discussions and debates. This is a very complicated issue that touches many different aspects and agencies, as you've heard. Personally, I'd like to thank the chairs, both Linda Schwartz and Mike Lawler, for all your efforts. We would not be here today without you really driving the bus or the force to get everybody to come together to address these issues. And also to Beverly for putting up with me and for all of the time that it has taken her to be able to man this really important committee. With that being said, I wanted to echo some of the things that the co-chair, Jonathan Steinberg, had said about this legislation and why there are certain changes within the language. We have a short session and we're trying to move the needle forward, but we realize that we will need more time to do some of the things that have been recommended. We have included money for the design of a new building, or the request for money. I'm on appropriations, so I will be fighting for that money for the design of a new building, which is absolutely necessary. The building, if you haven't been here on this committee, is something that you imagine a penal detention center of a third world country. It is a building of shadows that has to change. If you had to go to work there every day, you may end up being a patient there. It is so bad. It actually took my breath away how horrible the conditions of someone having to work there, or someone actually who is supposed to be there getting help would be placed in. And it has stuck with me, and I am determined to help try to move that needle in a place that we can be proud of here in the state of Connecticut. We have, as Linda has stated before, Yale is very involved in this, going all over the world, telling everybody how mental health should work. And we are not taking care of our own backyard. And it is embarrassing. It is a stain that has to be removed from the state of Connecticut. And I think we have an opportunity to be the shining star of what mental health for those who are, committed civilly, or also through reasons of not guilty for reasons of insanity, have an opportunity for a life moving forward and to heal and to get better. And I think the conditions of which you live are part of that healing process for those who are there, and also for those who work in those conditions, but it's not all of it. There's a culture there that must be changed. And we are hopeful that some of the very specific things you have recommended we can help facilitate that change, although it may take another session to be able to really push that forward. And I just wanted to touch on a few things. The reason that we created a PSRB working group is because we really need to have the Judiciary Committee on board to be able to do that. It's not that we don't agree with your recommendations. I've actually had bills in for the last 2 years to get rid of the PSRB, and they die in judiciary. So we felt it was necessary to have the public health, along with others, and the Judiciary Committee review the PSRB and absolutely come up with what would the process be to replace it. What does it look like? But we can't do that in our silo of just public health. And that's one of the reasons why we had thought it best to create another, unfortunately, working group task force to address those issues and to come up with a plan on how do we move this forward. I wish we could snap our fingers and it would be gone tomorrow, but unfortunately, that is not the case. And I do agree, I can't remember with who the speaker was, that the front-loaded system of determining competency has to change. I actually met a young man who was 19 years old, and he was told and his mother he would be there for 60 days. And I was there at one of his PSRB meetings, and he was there for 7 years. And the reason why he was not let out were these archaic rules that we have talked about. I'm going to ask you to speak to those on the lifestyle of someone there, signing in and signing out of crafts, or it's absolutely obscene. I couldn't follow the rules. Any normal 19-year-old boy could not follow the rules. They're archaic. I don't know who establishes that, but it's that culture that has to change. Staff morale is a huge issue, and I'm really glad that you touched on that. There's allegations of discriminatory practices based on race. There is bullying. You know, we actually got surveys from years ago that said it was going on. The agency wants to say it's not, but we clearly know that it is. So we can change that by changing who's at the top, by changing the culture, by changing the building, by changing the whole system. And it's not going to be an easy change. No one likes change, but I love change. And this is something that we've got to change. This is, I think everybody can get on board with this, because if any of you on the committee take one visit or even drive by it, you will see what we're talking about. I wanted to get your input on the idea of creating a working group for the building itself, including DEMIS. I'd love to have some of you all participate in that, because the design of the building, the way it's designed, do we have bars on the walls, on the windows, those types of things, I think also set the culture and are very important. And I would like to have everybody's input on that building committee, that we hope to get the money to be able to establish the plans for a new facility. I'd also like you to speak to and I don't mean any offense by this for anybody who's working for Yale, but to the nebulous Yale contract that is also a clear example of millions of dollars spent, but without any accountability. Because when something happens, the people running this facility work for Yale. They don't work for the state of Connecticut. So therefore, there has not been in the past any really accountability for what's happening from the head down. And I know that has to do with salary caps we have in the state of Connecticut. So I'm all for one who says maybe we need to revisit those salary caps for medical personnel that are delivering healthcare services in the state of Connecticut, because it's so fuzzy that there's no accountability. And I'd love for you to touch on that, because I know that you have reviewed that. And I could go on and on, but I won't. I will agree that the interconnection of the agencies is something that absolutely does not exist, that needs to exist. So we were hoping that would be something that we could discuss when we talk about eliminating the PSRB with the Judiciary Committee in how this is going to work going forward. How do we make that interconnection in a way that is intentional and it really has the patient-centered focus rather than punitive focus? I agree wholeheartedly with the review of someone's determination for 6 months rather than 2 years. That's something that absolutely must happen. And Lastly, I'm not sure everybody in this committee knows what a PSRB is when we're talking about it. I don't know whether anybody explained that. So I was hoping maybe either Linda or Mike Lawler, with your experience in the judicial system, if you could explain what that means. And I didn't know whether you noticed in this bill, we had that it will be a medical determination when a patient moves from one facility to the other within the CVH campus. It's not going to be, having to go back to the PSRB to get permission to move somebody from, Whiting to Dutcher. That is something that I find really against all kinds of, patient-centered care. So can you speak to all that stuff? I think it's really important for this committee to understand that going forward.
Well, Dr. Rodas, would you address the issue of the contract with Yale? Because I think we both reviewed that and came up with the same issue.
Well, I agree with the senator that my sense of the contract specifically was the lack of specific deliverables. And it just seemed as though, and the cost seemed to be going up year over year. And I wasn't exactly sure what we as citizens were getting for our money. Now, I want to be sensitive. Good colleagues at Yale, I think it's a great institution, and I'm not saying they're doing anything incorrect, but I do think there's a question of exactly the accountability and deliverables vis-a-vis the contract. However, it would be preferable, I think. I think we outsource things that we can't do well, and I understand that. And I think particularly staffing psychiatrists is a challenge for everyone in healthcare. So it's a matter of the staffing contract, but when it comes to running the place, I have to agree with wholeheartedly with our report that it would be best if that's run by state of Connecticut folks. Then there's a clear line of accountability. So those are my comments vis-a-vis the contract and the whole relationship, actually.
I would just like to say that the committee did feel that there would be more accountability if the person that was running the facility was actually a state of Connecticut employee, not somebody that was from Yale. And perhaps there would be more accountability built into that. You asked about the PSRB, and I have, that I can just say that it is in statute, and it was established in 1985 in response to sweeping reforms in the insanity defense across the country in the wake of the attempted assassination of President Reagan and the subsequent Insanity Defense Reform Act. I would like to say that Connecticut is one of only 3 states that has anything that even looks like that. Do you want to comment on that, Nancy? You sent me the stuff.
Well, frankly, I'd like to ask Mike if he could respond to Senator Summers, who asked him specifically to talk about the PSRB and explain it to those who may not understand it. So I'm going to thank you, Linda, but I'm going to defer to Mike.
Thanks, Nancy. And I'm sure, you've worked directly there, and I know Lori has a fair amount of direct experience working with the PSRB. So Linda, you gave the basic history of it, right? But I think it's important to understand that it is an entity which consists of a variety of people who are sitting like a jury on decisions that are made related to where a patient is housed and under what circumstances a patient's can be released to the community. And that doesn't necessarily mean just released and you're done and good luck to you. It's supervised or unsupervised community visits, pretty much anything you can imagine that's in that general category. But I think an important way to think about this, since many of the people we're talking about are in the position they're in other words, acquittees based on not guilty by reason of insanity, for having engaged in extremely serious and almost always very violent types of conduct, right? So it's not like shoplifters we're talking about. At the same time, the Department of Correction also supervises similarly high-risk people And none of their decisions within the Department of Correction about how to deal with an inmate or where that they should be incarcerated are made by an outside entity of non-DOC professionals. So it seems kind of odd that in the Department of Corrections, it's the department that decides where you're going to be and under what circumstances you're going to get a furlough or whatever. Here, it's almost like an adversarial hearing where the prosecutors are involved, and if you read the statute, it looks like the only thing that matters is public safety. It doesn't really factor in considerations like the best interest of the patient or the best care of the patient or the best way to return the patient to the community over time. And I think the fact that that's missing from the statute is almost like a public policy signal to the members of the board that when in doubt, don't let the person any closer. Care providers there, they view that as an obstacle. The fact that their decisions are second guessed, right? So as I said, Lori deals with this firsthand too, as does Nancy in her former role. So I defer to them on maybe some examples of this kind of stuff. I know Lori doesn't necessarily agree with every criticism that others have made of the PSRB, but it is first of all, it's unusual, right? It's unusual for sure. We're an outlier for sure. And whether it's abolished altogether or reconsidered or reinvented, you know, that's a decision for you to make. And as Representative Steinberg pointed out, maybe showing my bias from my former position as well, you know, it's a Judiciary Committee thing too, because it really has a lot to do with legalistics in the court system, et cetera. But in any event, I don't know, Lori,
I just like to point something out. So the PSRB currently, I mean, for people on the committee, they can, if there's a recommendation for someone to move from Whiting to a lower security unit like Dutcher, they have the say, not the clinician, this PSRB. And the PSRB is appointed. There's some people that have been on there for 20 years and they're really good at saying no, no, no. I've gone to a couple of the PSRB hearings and it feels like the determination's already made before you walk in the door, quite honestly. And these are people that have been appointed by a governor. They don't necessarily have to have any healthcare background, any corrections background. There are governor appointments. And again, all they look at is risk, the risk to the public safety. And you know, if you're truly looking or purely looking at risk, it would be impossible for anyone to say, even I'm not a risk for someone. You know, how do you actually determine that? And I think that's a big issue. And I wanted to share that I have met with many defense attorneys who have now told people that, you know, even if they are really suffering from mental illness, even at the time of a crime, do not go that way. You will never get out. Once you go to Whiting, you'll never get out. But if you go to the regular, you know, corrections method or line or silo, at least you have a chance to get out. Once you do your time, you're out. And so now we're seeing an increase in our mental health issues in our prisons also, not that we didn't have them before, but it's this vicious cycle. And attending those hearings, you know, I've gotten letters, I'm sure everyone else has, for people that if they had gone the DOC route, they would have been out of jail in 15 years. And now they've been waiting for 35, 40 years. And it's this never ending cycle of PSRB, nope, PSRB, nope. And one other thing I wanted you all to speak to is when the PSRB has the ability to say yes, and somebody has met this crazy threshold of being able to be sent to a step down unit or find a place in a facility, then you have to worry that DEMIS has the funding for that. And there's been people waiting that have been cleared through this process, but there's no money to send them to the step down unit or facility that is ready to take them, which I also think is criminal after being there for so long. Could you speak to those items also? I think that's important for the committee to understand.
Well, can I just, so there's as Senator Summers knows, it's really complicated stuff we're talking about, and I don't even pretend to understand it completely myself, right? But one thing that's important to keep in mind is if you are found not guilty by reason of insanity, you are committed to the Psychiatric Security Review Board, right? Like if you get convicted of a crime, you get committed to the Commissioner of Corrections. So you get committed to the PSRB, and they're the ones who make all these decisions. And you are housed at the hospital unless and until you are deemed less of a risk and you can be released from the hospital. But it's that status that PSRB has you once you're found not guilty by reason of insanity. And interestingly, before you get to that step, you probably would have been incarcerated in the Department of Correction for maybe a year or 2 or 3. And I don't think anybody would argue that that's a great place to get health care. And I think we've all seen that firsthand, let alone mental health care, right? It's just not conducive to good outcomes there. So anyway, it's just an odd sort of backwards way of thinking about this stuff, in my opinion.
I also think it's important to remember, this may be one of the words that I use over and over again, but it's for a reason, that there's nothing about the PSRB that talks about recovery. And that is what, in any situation, Dr. Rodas talked about it in a medical hospital. You go to a hospital to recover. And DMIS has as its underlying principle recovery. It's a recovery-oriented system, but there's nothing about the PSRB that speaks to recovery. That puts it at odds. So you've got this strange dichotomy of individuals being in a hospital system that's supposed to be about recovery, but being governed by a board, the Psychiatric Security Review Board, that is not interested in your recovery. They're only interested in whether you pose a risk to the community. So it's impossible for those two those two entities to really work together because they have diametrically different agendas.
Dr. Hauser?
Yeah, I was just going to speak to a couple of things regarding the PSRB, because I'm actually the one person on the committee that does still see some value in the PSRB. I wasn't supporting that it be abolished, but I do think there's some critical ways it can and should be revamped, and that some of the things can be changed about it. But I guess a couple of things to clarify is that while the members are appointed by the governor, there are individuals with from mental health backgrounds. So there's a psychiatrist, a psychologist, and another member who has a master's level clinician, along with like members of the judiciary. So it is sort of a mix of both mental health and judiciary folks on the PSRB. We are one of only 3 states, actually, I think only 2 now. I think Arizona was getting rid of theirs. So just us and Oregon that have this. And I guess my bigger concern is what Representative Summers mentioned kind of most recently is the folks that are deemed appropriate to leave that there isn't the funding for. So I see that as kind of the bigger risk. And I do want to, again, kind of remind people of like the inner workings of these different agencies, and you kind of change one thing in the system and it affects other things. So just as was mentioned, that if defense attorneys are kind of encouraging folks to not to go this route because you won't get out sooner, well, that also then I guess takes away from so if we can shorten the times that people are hospitalized and get them out to the community faster while still maintaining having the PSRB, if we remove it, then that may increase the likelihood of folks just going to DOC and serving long periods of time and not getting mental health treatment and not getting the services to help them work back out to the community in a safe way. So they may get out sooner, but they may not have addressed issues that are going to help them to be successful when they get out on the backside. So I think that the whole picture needs to, kind of be thought of in that way. So I do see there still being value in having that entity, because any way around it, even in states that don't have a PSRB, for folks that are not guilty by reason of insanity, it's not like the clinicians can just open up the doors and release the person like with the civil patients. There's still ultimately at some level tied to the criminal court because they did assert an affirmative defense. There is still a victim tied to the case. And so there's ultimately, it's the superior court that's going to make the final decision about their release, considering all those factors. So yes, the PSRB adds an additional step, but it also can be utilized as a way to help people get what they need through the system without being just sort of released without anything oversight.
Senator Summers, have we addressed the questions that you brought forward?
Yes, thank you. I do have more, but I want to defer and let other people have a chance to ask questions. I don't want to take up all the time asking questions. I want to thank you all. One other thing just quickly is the committee, the oversight committee that right now has no teeth, that can't even get documents. I think it's outrageous that they had to FOI Demas for documents when they're supposed to be the advisory committee. We want to change that. We also don't believe that an advisory committee should include a member of Demas at this point, because they're really supposed to be overseeing Demas. So you can see how that ship can be steered if you have somebody who's giving you the information that's coming right from the agency. And we want to give it more teeth so that when this oversight committee says we need the documents under XYZ, they are able to have the documents. And for people on the committee, this advisory committee had no idea about the abuse or the alleged abuse that was going on. They had to read it in the paper like other people. And this is the advisory committee to Whiting Forensic, which is, again, a system that's not working. So I thank you for that recommendation. We think that's a good one. And we're trying to figure out legislatively, how do we give them teeth? So, and that was designed to give them teeth in lieu of a inspector general. We got great pushback on the inspector general, as you probably can imagine. So I wanted to just make sure that you knew what the thought was behind the advisory committee having teeth. And I will now be quiet so everyone else can answer questions. Thank you.
Well, thank you, Senator. Well, hopefully we'll have time to come back to you, but we are towards the end of today's forum. I might beg to differ on having Demas on the advisory committee. I think you can give the advisory committee teeth and accountability, but keeping Demas off would actually create an oppositional structure, which may not be in your interest either. So that's something we can talk about. Senator Anwar, followed by Representative Pettit.
Thank you so much, Mr. Chair. Thank you for each and every one of you who are here and the ones who have participated in the process. The report was very refreshing because it was very frank, and it clearly indicated that each and every one of you rolled up your sleeves and said, we are going to fix this. And we usually do not see reports like this in the legislature. So it was very refreshing and good, and showed the intent and your commitment. So we cannot thank you enough. I think Senator Summers has asked some of the questions, and I was going to frame the question the following way: that you've been very clear in some of the components and you've been a little bit gentle in some of the others. And I wanted to probe some of the areas that you've been somewhat gentle on. At least that's my reading of your report. You have not spoken too much about the opportunity for the unions to have been a part of prevention of things moving in the wrong direction as they had. And you've also touched on the oversight of state agency by a state agency. You have suggested that, but I think DPH overseeing Demas facilities, you've touched on that. I think that needs to be probed more, and the necessity of this, especially since we're going to be looking at a bill or talking about Department of Correction oversight for healthcare facilities for them too. And the third thing is the Office of Inspector General. Should that be within the Attorney General's office, and then how can that be an office that can actually be more effective? So 3 things if you can touch on. And thank you again for each and every one of you for your work.
Representative Pettit, as soon as you're done shifting.
Thank you, Mr. Chair. I think Senator Summers did a great job reviewing a number of the issues. I have sort of a broad philosophical question to throw out to the task force. and that is, in what way do you see your report, and if the legislation passes, impacting victims of crimes? Would it make things better for them over time, worse for over time, or really have no impact upon the victims involved in this process? Thank you, Mr. Chair.
We lost the last bit of that, Representative, but
I'll,
go
has
ahead,
an-
Nancy.
Okay, thank you. Actually, I think it serves the interests of victims as well. Neither the correction system nor the mental health system ever provides for, I mean, the correction system does obviously to some degree, but certainly the mental health system is not designed to lock somebody up and throw away the key. The idea is to help people recover and become productive members of society. And frankly, the correction system, one would hope, would be interested in returning people to society who can become productive members. What you have by looking at more of a recovery model for a place like Whiting is that you are going to have people who can return to the community and become productive members of society. They will be treated with compassion and with dignity, which is a much better way to ensure recovery than the punitive nature of the PSRB and the punitive nature of Whiting at this point, and certainly the punitive nature of the facility. So I know that some victims are anxious that people will be getting out of Whiting willy-nilly and get to be able to, and run the risk of repeating their crimes. But if you have people who are engaged in recovery, that's not going to happen. And I feel very confident that this is a way to improve the lives of the people in Whiting and the people who, and the victims who can feel assured that people, when they get out, are in fact going to be recovered.
Yeah, thank you. Thank you for that. I think that, I think sometimes the people that are involved in this feel like they don't have a voice. I know the victims often feel like they don't have a voice, and people tell them that it's not you, it's the state of Connecticut versus said perpetrator, and you're removed from this discussion. So often they feel like they're making noise, nobody's listening. So I appreciate those comments. Thank you.
Thank you, Representative. We're near the end of our time today. Let me ask one of the more thorny questions that have certainly been on my mind. There's been reference to the fact that things still aren't great. And the question I have for you is, and this is something almost impossible to accomplish via legislation, how are we doing in changing the culture of the place? How much change has occurred? We've talked to people who have said things are much better. We're doing things differently now. We've got this under control. What would be your response to that?
I think that we spent some time in our report talking about staffing, the overstaffing, and some of the mandatory overtime. A very big part of what takes place in these facilities is the staff. And we talked in our report, we mentioned the fact that they don't even actually debrief some of the incidents that happened. It's like it didn't happen. And I think another thing that was stunning for me is that some people that work there are required, if they've made an infraction, or they're required to sit in a room all by themselves, a staffer. So you have to ask yourself what kind of, who would want to work there? There has to be an investment in the staff, and the idea that it's more than just coming to work in the building, but that we suggested that there be training in person rather than by computer, and also that there be some team building efforts within the staffing itself. I don't work there, so I can't tell you if it's improved or not, but it doesn't seem to be that much better
Seems that Paul,
because of some of the attitudes of the staff.
Paul?
Yes, thank you. I think our report, or at least the survey, touches on the disconnect that they're experiencing between the head and the hands, that administration's not trusted and vice versa. You know, especially when it comes to direct supervisors, the report seems to show that the frontline people, that there's a huge disconnect there. So I would be kind of suspicious of where I hear that it's getting better and where I hear that it's not. I think that there is an ingrained culture at CVH and Whiting that is been set in stone for at least half a century, if not longer. That is kind of an undercurrent that's going on that nobody talks about. And so, you know, I don't know how we monitor this. I don't know how we get good metrics on it. But again, if you look at the survey from, you know, 4 years after it was placed under the microscope, it's not getting better on that level.
Thank you. Dr. Hauser.
Yeah, and I'll just add a couple comments from being there, from working there, being a part of it. I will say that there's certain things that I would say are improved, and there are certain individuals that have had a hand in that. There are other things that are still concerning, and I would say I certainly can't speak for everybody at the hospital, but I do know that an undercurrent of concern is the staffing levels. And I know people are quite concerned with the wave of retirements that are expected this year and what's going to happen. We actually have been at a kind of decent staffing level recently with some new hires, but that is always a concern, is how that's going to fall out. And people do feel that their decisions aren't trusted all the time. And again, that's not, I don't want to make a blanket statement about like all of the administration or all of the staff, but there are certainly instances where people feel like their decisions are not trusted or not considered, or their input is not taken into account. So it's those I would say are probably the two primary things that that people are feeling. And I will say that for the individuals that were not directly involved in what occurred, all still had to live through the last 4 years, and it was difficult for those individuals as well, for everybody else at the hospital. So I would say there's probably things that are better, but other things that are still concerning.
Nancy?
One thing I'd like to ask the committee to do in terms of thinking about have things changed is to pay particular attention to the letter that I believe most of you got a copy of, the letter from DRCT and CLRP to DEMIS. I guess it's fair to categorize it as a demand letter. They are people with boots on the ground, and the same role that I had when I was at DRCT in my role as a patient, as an advocate. So in terms of where things stand now and what the issues are now, I think that letter is a good indication of where there still are significant issues.
Thank you for that. We'll take a look at that letter. I understand that Mike Lawler has to leave us shortly. Mike, given how cold it is up here, we all wish we were with you. But if you have any final words, we'd appreciate it.
Well, it won't make you feel better, but it's 75 degrees outside here right now. So just so you know, but in any event, I can't add too much more. I will say in response to Senator Anwar's question earlier that I do think the unions involved here have been involved in these discussions. It's also worth noting that there are people that we've talked to that feel they're not, especially when it comes to this racial tension issue that's very real based on what I've seen, that the union was not as attentive as they might have been to that. So there's that, as you pointed out, Senator, I'm using kid gloves here a little bit, but there's a real problem. I think everybody who needs to be aware of that is aware of it at this point. And the final thing I want to say, because I actually do have to jump off to do something else, is that keep in mind, we're talking about the deepest of the deep end of this system. We're talking about a relatively small number of people with relatively high needs and relatively high risk.
Good morning. How are you?
And I think, as many of you have been pointing out,
I just got a letter from
earlier in the system.
forensic and
I'm sorry, Mike. Beverly, could you please mute?
For the public hearing, and none of them are on my list.
Beverly, could you please mute? Thank you. Sorry, Mike.
So I just want to say, I think you heard me say this is the deepest of the deep end of the system. And as many people have pointed out, earlier intervention with appropriate care and support might have prevented a lot of these serious incidents in the first place. And I think don't be distracted just by this aspect of the mental health care system. This is, this is the deepest of the deep end, is all I'm saying. And so we're talking about the competency to stand trial, the earlier court intervention, the alternatives available in the community. I think those things might go as far as fixing the problems that we're complaining about as a new building and new staffing and new stuff as well. So I think both have to be pursued with equal energy. But in any event, I do have to jump off. I apologize. I appreciate this opportunity. And I'm very encouraged by what I've heard from all of you here today. So thank you.
Thank you, Mike, for your work. This really is at the end now of the time we had allotted for this. We're going to be starting a public hearing shortly. But if Senator Summers had anything she wanted to add, sort of by last words or questions, I want to avail her of that opportunity.
Thank you to all the committee members. I hope after you hear the public hearing, when people will be making comments, etc. If you hear something during the hearing that you agree with or don't agree with, please feel free to please reach out to us and let us know so we can craft this legislation to make sure that it is as good as we can possibly get it for this short session. And for committee members, I'm sorry I took up most of the time asking questions, but please feel free to ask questions during the public hearing, because I know there will be people testifying in support of the bill, and feel free to ask them also questions that you may have going forward.
Thank you, Senator. As she mentioned, we're about to start a public hearing process where this, among other bills, will be discussed, and we'll have testimony from a lot of different people. We've just touched on a number of these subjects. We haven't had a deep dive into some of them, and many members of this committee would want additional information. But I think it was very important for us today to have this interactive forum, such that not only can we be better acquainted with the background behind the recommendations, but the public becomes aware of just how dire the circumstances have been, that we still have a long ways to go, and how important this legislation is in taking us down that path. If there are no further comments or questions, I want to thank the members of the task force who could join us today. And I want to thank my colleagues for their good questions, and we'll see you all in 25 minutes. Thanks very much.
Thank you.